Assessing the heart, find the angle of Lewis at the manubrio, sternal junction, a visible and palpable angulation, where the second rib articulates with the sternum, slip fingers down each side of angle to feel adjacent ribs. The intercostal spaces are just below each rib. Find the following anatomic landmarks. The aortic area in the second intercostal space to the right of the patient's sternum. The pulmonic area at the second intercostal space to the left of the patient's sternum. The second pulmonic area, found by moving down the left side of the sternum to the third intercostal space, also referred to as herbs. Point the tricuspid area at the fourth left intercostal space. Along the sternum, the mitral area, found by moving fingers laterally to the patient's left to locate the fifth intercostal space at left midclavicular line. The epigastric area at the inferior tip of the sternum stand to the patient's right, with him or her supine to inspect and palpate the precordium note. Any visible pulsations and more exaggerated lifts at the anatomic landmarks. Closely inspect the area of the apex palpate for pulsations using the proximal halves of the four fingers together, and then alternating with ball of hand at all anatomic landmarks. Locate the PMI by palpating with fingertips along the fifth intercostal space in the mid-clavicular line. Note, a light brief pulsation at the apex. If palpating PMI is difficult, turn the patient onto the left side. Inspect the epigastric area and palpate the abdominal aorta note. A localized strong beat. Auscultate heart sounds. Begin by having the patient sit up and lean slightly forward, then have him or her lie supine in the examination, with the patient in a left lateral recumbent position. For a female patient, it may be necessary to lift the left breast to hear heart sounds more effectively. While auscultating sounds at each anatomic landmark, ask the patient not to speak, but to breathe comfortably. Begin with the diaphragm of the stethoscope, and then alternate with the bell use, very light pressure for the bell inch. The stethoscope along, avoid jumping from one area to another. Do not try to hear all heart sounds at once. Begin at the apex or PMI, then move systematically to the tricuspid area, second pulmonic area and pulmonic and aortic areas. Listen for S2 at each site. It precedes the diastolic phase, and sounds like dub S2 is heard best at the aortic area. Heart sounds vary by pitch loudness and duration, depending on the auscultatory site. Normal sounds, AS1 and S2, are high-pitched and best heard with the diaphragm. After hearing both sounds clearly, as lub-dub count. Each combination of S1 and S2 as one heartbeat count the number of beats for 1 minute. Assess heart rhythm by noting the time between S1 and S2, systole, and then the time between S2 and the next S1, diastole. Listen to the full cycle at each auscultation area. Note regular intervals between each sequence of beats. There should be a distinct pause between S1 and S2.